today I'm having my 6 weekly blood exchange transfusion. What that means is basically I'm having most of my sickle cell blood out and having new 7 bags of blood put in to reduce the S level in my blood. And that helps me in that it reduces sickling episodes, gives my liver a better chance. Basically, this was recommended after my liver transplant, and my liver was damaged because of cirrhosis. So basically, blood, clots in my liver due to the crisis, due to sickling, because what the sickling does is it blocks blood vessels in your organs and joints, and it has caused so much damage in my liver. Now, I did get a transplant, thankfully, but to give that liver a chance to last a whole lifetime, I needed to prevent the sickling again, which is why this was recommended. Initially, because it was costing a lot to travel and the time off work, and I had a little child, time off, childcare and all of that, I was doing it manually, which is quite painful because, it's usually a bag in, a bag out, a bag in, and each time needle in, needle out, needle in, needle out, and it was just painful and horrendous, took much more time. This is so perfect, simple, easy. I'm done in less than three hours, I'm out, and that lasts 6 weeks. So if local hospitals could get this machine, it will be, it will help a lot. It will improve my quality of life in that I don't have to drive, 1.5 hours here, another 1.5 hours back. Sometimes I'm tired. It means I'm back at home in time to pick my daughter from school. It means I can still go to work. I can have this done in the morning and then go to work. I'm just lucky here in Addenbrooke's that they've given me the chance to have the blood matched on the same day, because ideally you have to come a day before to have a blood match so that the bags can be ready for the automation the next day. But in my case, I spend the whole day in hospital because the first couple of hours is done, just getting the bags ready for the blood match before doing the exchange. Sickle cell, you hear a lot about, people not understanding it, professionals not understanding it. And I think the reason for it is it's a blood-related disease. There's not much in terms of treatment for it. And it affects people differently. So you can have 2 sickle cell patients that will have different symptoms, 2 different set of symptoms and treatments. So it's been a long way coming from how to deal with the pain, how to explain how and the level of the pain before the 1 to 10 system came in. It's just difficult to explain to people how you're feeling and for people to believe you, especially where, like I said, there's no treatment. Most of the treatment are just, coping mechanisms. So you do use a lot of opiates to cope with the pain, not, deal with it, but to make us comfortable. Because physically, most of us look fine. There's nothing wrong with us except that we're in pain and we're rolling and crying. And, to just look at us, sickle cell is not a physical disease, so it's difficult to understand. But since, in the last 10 years, there's been, leaps and bounds, a little more understanding about the disease. There's been physicians as well and consultants who have taken a particular interest in it, like Dr. Besser. He's been very good. And I think, there's still a long way to go. But, it is improving. It has improved, I will say, over the years.